Hello. Epilepsy is a condition that affects the brain. Someone who has epilepsy has a tendency to have seizures, which are also known as convulsions or fits. It is one of the most common brain conditions in the world and affects almost 1 in 100 people in the United Kingdom. A single seizure doesn't have to give you a diagnosis of epilepsy. It is possible for anyone to have a one-off seizure. Epilepsy is diagnosed when someone has repeated seizures. Most people develop epilepsy when they are young. However, it is possible to develop epilepsy at any age, even when you're elderly. For most people, it will be a lifelong condition that may require long-term medication. Many people think of a seizure as someone's body shaking uncontrollably and making jerking movements. This is a tonic-clonic seizure and is just one type of seizure. In other types of seizure, a person may seem to switch off for a period of time or make unusual movements, such as smacking their lips together. During some types of seizures, the person may be awake and responsive, and with other types, they will be unconscious. Usually, a seizure will last somewhere between a few seconds and a few minutes. Some people with epilepsy will have seizures very frequently, while others may have one every few years. If you are given a diagnosis of epilepsy, it is important to ask your doctor what type of seizures you have so you can understand your situation. Your brain contains billions of nerve cells which are continuously sending electrical messages to each other and to the nerves in your body. When you have a seizure, there is a burst of abnormal electrical activity within your brain which presents itself as a seizure. Different parts of your brain control different parts of your body. That means that the type of seizure you have will depend on where the abnormal electrical activity happens in your brain. This is why there are different types of seizure. There is no single test to diagnose epilepsy. Instead, doctors take a detailed history of what has happened and arrange investigations. These investigations rule out other causes of seizures apart from epilepsy. Tests include blood tests, an EEG, which is a recording of your brainwaves, and brain scans, such as a CT or MRI scan. Unfortunately, there is no cure for epilepsy. However, epilepsy can be well controlled nowadays with anti-epileptic medications. These help to prevent seizures or reduce the number of seizures you have. The medications are available as tablets or liquids. It is important to take your medicine regularly and never stop it abruptly without speaking to your doctor. If you miss 1 or 2 doses, you should start taking it again straight away. Occasionally, people's seizures can't be controlled with medications and they require other treatments, such as brain surgery or a special procedure called vagus nerve stimulation. This is when a stimulator device is implanted under the skin of your chest. It is sometimes referred to as a pacemaker for the brain. If you or someone you know has epilepsy, please speak to your GP or the specialist epilepsy nurse for advice.